So today I'm going to do a little bit of a Keto 101 with some things to think about if you're struggling, and then go through, the usual common questions, but always with some new little papers that have come out, and then we'll answer some questions. But you know me, I get all tied up in my slides and end up going over, but we'll see what we do. So why do diets work in general? Kind of trying to say why do I like a ketogenic diet over other diets? But all diets really work to some degree because they're cutting out ultra processed foods, right? They're cutting out the sugars, the baked goods, the desserts, the pizzas, the ice creams, the things that do that carb fat combination. That's not actually a natural combination in the world. Most foods are proteins with some fat, or they're carbs with protein, like vegetables and nuts. But foods that are made by factories are made to be hyper palatable. They are made to lead to overconsumption. These foods tend to be very low in what we would call protein to energy ratio, and we will eat until we actually reach our protein needs. And this has actually been proven in every species. So the more watered down our protein to energy becomes, the more we end up eating. So if we're eating low fat, but we're concentrating on protein, we actually do okay. And if we do low carb and we're focusing on protein, we actually do pretty well. But we can overdo both carbs or fat in any type of diet. I have, again, my biases as to why I like a low carbohydrate diet. But again, the worst foods is when we combine these carbs with fats. And I usually say, please avoid the center of the grocery store. And if it comes in a box or a bag, you probably shouldn't eat it. It really is sticking to the outer edges of the store. I always like the amount of sugar in various foods, but even, we think of, I have a number of colleagues that think naked juices are healthy, right? Because it's just juiced fruits and vegetables, but many of them have far, far more sugar than your body can handle. We can handle 1 teaspoon of sugar in our blood at any one time. If we take in more than that, then insulin gets released and we start pushing it into cells. And even things that are starchy, like breads, rice, and pastas, really just break down into sugars. So sadly, there was a recent publication in JAMA that looked at the trends of consumption of ultra-processed foods in youth, ages 2 to 19. And can you believe that unprocessed or ultra-processed foods made up 2/3 of the average American kid's diet? 2/3. That means 1/3 they might be getting some real food, but even then I question it. This is energy-rich food and nutrient poor. So we have to really get back to eating real food. So what is a ketogenic diet? Really, a ketogenic diet is any way of eating or not eating that puts you into a ketogenic state, i.e. producing ketones, beta-hydroxybutyrate. The oldest ketogenic diet in the book is fasting. And Mark Twain said a little starvation can really do more for the average sick man than can the best medicine or the best doctors. Fasting was one of the earliest treatments for diabetes, for epilepsy, but it was not attributed to being a ketogenic state. They didn't understand it at the time, but they knew it worked. So what happens? Our glycogen stores get depleted, our fat gets mobilized from fat cells. And during this time, there's something that happens called autophagy, where damaged cells get removed and their parts get recycled. The downside of fasting is that you can't actually fast indefinitely. We still need nutrients. We still need energy. So Dr. Wilder at the Mayo Clinic realized that the benefit of fasting was actually due to these ketones, and he coined the term the ketogenic diet. Ketogenic diets or fasting mimicking diets really just replace carbohydrates with fats, and the body then produces ketones. So you get essentially the same effects or benefits of fasting, but while maintaining your protein intake, your caloric intake. So if you need to lose weight, we can work on that by decreasing caloric intake, but if you needed to gain weight, we could actually up it. There are various forms of ketogenic diets based on the level of carbohydrate restriction and fat intake, but typically ketogenic diets are somewhere in the 70 to 80% fat by calories. So to understand ketogenic diets, really we should understand insulin, right? I talk about insulin all the time. So insulin goes up in relation to the micronutrient intake / glycemic index. So the higher the sugar content, the higher insulin has to go up. Insulin is also a growth hormone. It is also lipogenic, meaning it grows fat, or some people call it a fat storage hormone. When insulin is on, it shuts down the release of fatty acids from body fat. So it basically says, nope, you can't get out. I've got to put stuff in. So it's managing the intake of food. But when insulin does get low enough, you can go back to burning stored fat or lipolysis. Then that lasts until you eat again. But if your insulin is high all the time, then you're never turning on the signals to burn fat. You're always in storage mode. We've seen this many a time, but blood sugar responses to macronutrients. Macronutrients are carbohydrate, protein, and fat versus micronutrients, which are vitamins, minerals, electrolytes. You can see if you had pure carbohydrate, you would have a very sharp spike in your blood sugar. If you took pure protein, you'd have less of a spike. And if you had fat, you would have a very low spike, but it would go longer. But no food in nature is a single macronutrient. It's always a combination, either carbohydrate, protein, or protein, fat. So I always like to show blood glucose levels in people. So this is the same person eating two different meals, one being a very low carbohydrate, high fat, where the green line stays very steady blood glucose throughout many hours. Whereas in the other example, same person eating, it was actually a tuna sandwich on whole wheat bread with a yogurt, an apple, and a candy bar at an obesity conference. And you can see that his blood sugar dramatically spiked and then almost came down too low because his insulin spiked far too high. I always like to share this one too, because this shows multiple people, but eating the same meal. So it is very personal as to what your carbohydrate tolerance is. So the yellow examples where they kind of went up 20 points and then came back down within 2 hours, that's a pretty good blood glucose response. All the other ones are actually abnormal. And this was a really nice curve. There's actually a company called Metabolic that has some home insulin tests. They're very, very, very expensive. They're kind of in beta right now. But this was an example of a patient that they saw, and then sitting in the office, they gave that patient a meal challenge, and then they measured their glucose and their insulin about every half hour out to about 5.5 hours out. And you can see that this patient's glucose really didn't change dramatically. It did go up a little and then came back down. But look at that insulin. So if we just stay in our glucose-centric world, we may miss some big underlying problems. So really we should be focusing on looking at insulin and not just at glucose. Kraft did that in 1975. He looked at 14,000 patients and measured their fasting or measured their insulin response to a glucose or a carb challenge. And you can see that curves 2, 3, and 4 are far higher and longer than curve 1. So curve 1 would be the ideal curve. Curve 5 would be somebody who is not producing insulin properly, like a type 1, or more likely actually an end-stage type 2. And I put the little blue arrow at hour 4 on this curve where you can see that glucose going too low. And the rationale or the reason behind that is Dr. Einfeld's insulin was far too high. So it kind of over-responded to get this sugar down. And then it ended up bottoming his sugar out until it came back up or equalized. A lot of people who are very sensitive to this will actually at around, 120 maybe of blood sugar, they might start getting really hungry because this pattern has happened to them in the past, and their brain says, oh, if you don't get some sugar now, I'm going to bottom out. And so they actually do need to eat or feel very hungry at about 2 to 3 hours after their meal, because they can feel that sugar coming down. So what is different about a low carb, high fat diet or ketogenic diet? Well, it primarily lowers glucose and thus insulin levels very, very effectively. It allows the body to burn fat for fuel more efficiently. And when fat is burned for fuel, you get the ketone bodies. And ketone bodies are inherently anti-inflammatory and healthful in and of themselves. But the bigger thing is it really keeps blood sugar stable. And I think patients then feel more stable, less hungry. They feel like they have more energy. They don't have those ups and downs. No one has the 330 sugar crash. And when you are on a ketogenic diet, you are able to maintain or even build muscle mass. When you're in ketosis, it allows for your hormones to function properly. So the signals, the hunger and satiety signals, meaning when are you really hungry? Because some people can eat a huge meal, and when they're done, they still feel hungry despite the fact that they're stuffed and they know they can't fit anything in there, but their brain is telling them that they're hungry. So those hormones are messed up. When you are in ketosis, you get that fasting autophagy, the recycling cells and cell byproducts. So there's a little improvement or health benefit to being in ketosis. Being in ketosis is self-regulating. Typically, you don't have to count calories because you're just not really that hungry. And when you're hungry, you eat. And it tends to kind of regulate itself. So almost every trial that is done using a ketogenic diet allows patients to eat ad libitum, meaning when they want. Whereas a lot of the low-fat diets, they actually calorie restrict. There are a huge number of benefits to ketones, and many of them are under current investigation, but you'll see more and more, I think, exogenous ketone supplements pepper the market as we get more and more understanding of their benefits. But my bias is taking them, just by a pill or a drink may not get you the true benefits of being in ketosis. It might give you some of the benefits of ketones. So if you had a brain injury or seizure disorder, just getting those ketones, that might be a great way to deal with that disease. But from a true health benefit, getting your weight under control, getting in the proper nutrients, eating a ketogenic diet tends to improve you on all levels. So what is a basic ketogenic diet? It's a very low carbohydrate, a moderate to high protein diet, high fat. So fatty proteins, so the fattiest: fish, beef, eggs, lamb, chicken. I do chicken thighs, wings with skin on. You can do pork, healthy fats. I usually say typically the fats that come in your food are the healthiest fats. If you're going to add fats, you should choose from animal fats or fruit fats like olive oil, avocado oil, coconut oil, but not fats that come from vegetables, nuts, or seeds. So those oils tend to be very damaging, high in omega-6, very prone to oxidation, and typically we never know that they are oxidized because they don't smell or taste any differently to us, but they are wreaking havoc on our cells. Low carb vegetables, so I usually say above ground vegetables, so leafy greens, non-starchy vegetables, cruciferous vegetables, and then low carbohydrate fruits, which doesn't leave a ton because most fruits are very high in carbohydrate, but you can do occasional berries, and then I always like to say my non-sweet fruits like avocados, olives, tomatoes, cucumbers, and peppers. And I do try to encourage anybody, if they, feel like they need to be a vegan or a vegetarian or a pescatarian for any reason, that it can still be done. It's just very difficult. So we might give them a little more leeway. Can it also be done as a carnivore, meaning no plants? Absolutely. But I would say the majority of people use an omnivore approach. This is a great study looking at two good diets, so a ketogenic diet versus the American Cancer Society diet, which is a Mediterranean diet. And you can see that both diets do help patients lose fat mass, visceral fat, lower glucose, lower insulin, and lower insulin like growth factor 1. But you can see that a ketogenic diet just does it better, does it more efficiently, and typically does it without cravings. So it tends to be something people can stick to for longer. This was a study that was done looking at patients with metabolic syndrome. So that's the first column. They started with 6 women and 8 men and in each group, and they put a third of them on a very low carbohydrate diet, a third of them on a medium carbohydrate diet, and a third of them on a high carbohydrate diet. And they kept all their calories the same. So that if they were obviously low carb, they were high fat. If they were high carb, they were low fat. And what they found is that there were far more improvements or reversals of metabolic syndrome when you used a low carbohydrate, high fat approach compared to any other approach. And I guess I would go back to saying that most of our cancer patients do tend to have some degree of metabolic syndrome. Not all of them, but a good proportion. So when we looked at results from 3 randomized clinical trials looking at pre-treatment fasting glucose and insulin, those who had borderline high or high fasting blood sugar lost the most weight with low carbohydrate diets versus low fat diets. And there was a stronger association when fasting insulin was high. So if somebody actually has a normal fasting glucose and a normal fasting insulin, they may get equal benefit from doing a variety of diets. But when we have some degree of metabolic dysfunction and we have either a high glucose or high insulin, we very likely need to use a low carbohydrate diet. And just remember, because I get all the questions, wait, we're not supposed to eat meat. Meat is bad, right? Well, all of the studies, quote unquote, that show meat is bad always do not control for healthy user bias, or may I say unhealthy user bias. So the epidemiologic studies that show that meat is bad does not control for carbohydrate intake, for inactivity, for obesity, for alcohol, for sugars. And when we do interventional trials, so we actually take a portion of the diet and we replace it with protein, or we replace it with fat, or we move somebody into a low carbohydrate thing, we always see better improvements in metabolic markers. So it's not about the meat per se. It's what is coming with the meat. What are those people doing? And if you think about it, we've been told meat is bad. So the people who care about their health are typically less likely to eat meat, right? They're going to eat more fruits and vegetables, and they're going to exercise more, and they're going to take care of themselves. But it's not because they've excluded meat. It's because they're taking care of themselves. The other question is always, wait, if we eat less fruits and vegetables, we're going to get less vitamins and minerals. And I will say that animal products actually tend to have far more vitamins and minerals per ounce. This is per 100 grams. You have to eat a lot of kale to get 100 grams or to get a weight equivalent to beef or beef liver. So I'm not a huge fan of the taste of beef liver, but I'm certainly a huge fan of the nutrient density of beef liver. So if you can incorporate it in any way, in a pate, in maybe some liverwurst sausages or something like that, it's a great addition to getting good nutrient density. And then we'll go back to this protein to energy ratio. So protein to energy is fat and carbs. Protein is protein. So those foods that are higher in protein to their fat or their carbohydrate content are going to be more satiating. We're going to, we need to eat until we reach that protein intake. So interestingly, animal foods and low carbohydrate plant foods have very high protein to energy ratio, where other foods do not. So once we start processing, so even butter and cheese and peanut butter, we start to go down in our protein to energy ratio. And certainly carbohydrates are always going to be the higher they are in carbohydrate or fat, the lower it goes in that protein to energy ratio. So if we look at protein density using various types of proteins, so the plant proteins would be the top 4 lines, beef being the bottom line, and just trying to get to 25 grams of protein. I usually like to see 30 grams of protein in a meal, but even getting to 25, you'd have to have 666 calories of quinoa, or 3 cups. Peanut butter, you'd have to have 613 calories to get your 25 grams. Black beans, a little bit less. Edamame, less. But beef, 3 ounces of beef, it's just 173 calories, and you're getting 25 grams of protein. So you can get, again, a better bang for your buck when we move to animal-based foods. When we look at how we can incorporate lots of plants in a ketogenic diet, so 1 cup of oatmeal is about 20 grams of carbohydrate, and when you can actually have everything on the other page for the same net 20 grams of carbohydrate. So if we subtract out fiber, but 4 cups of spinach, a cup of peppers, a cup of mushrooms, a cup of broccoli and cauliflower, half of an avocado, 20 almonds, and half a cup of blueberries. That's a lot of food in place of a cup of oatmeal, and you'd actually get a pretty nice, not a ton of protein, but you'd get a nice amount of protein eating those plant foods. So when you do a ketogenic diet, do you have to track macros, or do you have to check for ketones? No. I say it's usually a good idea to track carbs initially, just to understand how many carbohydrates are in different foods, different serving sizes. Sometimes you realize you could just make a couple of swaps and lower your number quite a bit, but really not lose anything in texture or taste. Some people do like to check ketones initially, just to say, okay, this is what I feel like when I'm in ketosis, but it is also not necessary. I may have somebody check. Again, depends on their situation. What are we trying to accomplish? Or are we stalled out? Are we having a hard time? But if you are following the food rules, you're seeing success, you're feeling great, you're losing weight, everything seems to be moving in the right direction, then it's really not necessary to track. I feel like I check in on an app, food tracker app, maybe once every 6 months, and it's not usually to do a whole meal. I might just be looking up something that I haven't had in a long time, or I'm trying a new challenge for myself, and so I just want to kind of check in and see what I'm getting as far as fat to protein. Making ketones does not necessarily mean you're keto adapted or fat adapted. It means that you're making ketones, but you might not be using them efficiently yet. So that's kind of why in the Atkins stuff that they use the urine strips to check ketones, because you spill a lot of ketones initially. But ultimately you may start using them quite efficiently. I will say, if you can exercise fasted, if you can skip a meal here or there, if you feel like you can work out and then go and do a bunch of errands and not have to go immediately and refuel, then probably you're pretty well fat adapted, that your body is able to access those fat stores without too much difficulty. The main thing is I like people to eat real whole foods, animal proteins first. You can add some natural fats, but you don't necessarily have to if you choose fatty enough animals. Add some leafy greens and non-starchy vegetables. If you want to add nuts, seeds, or berries, you should do them in limited quantities. A sample day of eating real food looks pretty delicious. And that's some mashed cauliflower on the side there on the dinner. In a pinch, can you run through a drive-through? Yes, but throw away the bun. I usually throw away the processed cheese. There are some nice salads. The one on the right is one of my favorite grilled veggie salads at California Pizza Kitchen. You can get it with salmon on it, and then I just ask them to bring olive oil to the table, and I use that as my dressing. So really you can go. I usually won't get a salad at any place that I don't know what kind of dressing they have. So most of the dressings are made from soybean oils, especially the fast food ones. If you're going to a nice Italian restaurant, you might get lucky. But for the most part, most dressings are going to be inferior. So I usually just stick with an animal product, steak, a piece of fish, a burger patty. A lot of the burger places now will give you a fried egg on top, which will give you a nice wetness so that you don't need to use their mayonnaise. You can use mustard, should not use their ketchup, which is usually a high fructose corn syrup. Avoid most sausages and lunch meats. They usually have a bunch of stuff added in. You just have to read labels. Most salad dressings and mayonnaise are made from vegetable and seed oils. You can always do like a taco salad and then use guacamole or sour cream or salsa as your dressing. Even egg products will have hidden ingredients. The Starbucks cups, if you read it, they've got a lot of added stuff, and I want to say it's like 7 grams of carbohydrates for 2 little egg cups, which you shouldn't have. And IHOP too, I think they add like pancake batter or something into their eggs. I don't know what they do, but beware. Fried eggs, at least you know it's just an egg. Processed cheese slices. So the American cheese is only about 40% real cheese maybe, and it's soybean oil, so stay away from those too. Again, read labels. McDonald's has some things in it, dextrose and sugar. Jimmy Dean's has a lot more stuff in it. But Jones Dairy Farm cooked sausage links, just pork, sea salt, and water. So read labels. And how do we ensure success? Well, we want to make sure we're eating below our own personal carbohydrate tolerance. Remember, we showed how everybody kind of had different curves to the same types of foods. So I usually say if we go very, very low carb keto, everybody's going to eat below their carbohydrate tolerance. But there is wiggle room based on your age, genetics, diseases, exercise. So there's a lot that goes, how long you've been eating low carb, could you eat more? Although I find the longer I eat low carb, the less carbs I care about. But eat naturally fatty foods, cut out all sweeteners. You know, I save them for special occasions, but I'll tell you, every time I do that, and then I fall off the wagon for weeks again. So I really work to not do them. And then try not to drink your calories. So don't do fatty coffees unless you really needed to for some reason. If you can go drink 0 calorie, meaning black coffee or black tea, or I don't care if it's green tea, but not putting cream or sugars or sweeteners in it, that would be the best. I always do challenges, so you can do 30 days black and then see if you can do it, because usually the first week or two you think, oh, this is terrible, but by the 3rd or 4th week, you're like, hey, this is pretty good. So challenge yourself, do different things. Don't snack. So ideally, you should be eating 1, 2, or 3 meals a day, and not eating in between. Every time we eat, we are stimulating that insulin response. So we will have some degree of insulin production. So we'll try to minimize it just to getting food in, making, growing muscles, and then let it come down. I will say that cheese and dairy and nuts can get people in trouble because they're easy to overeat. So just be aware. I will say eat at home as often as possible, because then you know what's in your food, you know how it's cooked. Pack your lunch, plan, meal prep, try new recipes if you're bored. I find that I like the same easy things over and over and over again. And I only do recipes if I'm entertaining other people. I will say look at menus ahead of time. That has happened to us before, where somebody has said, hey, let's go here. And we look and we're like, could we pick somewhere else? Because really there was nothing that we were going to be able to eat, which we've still done and gone and had just drinks and chatted and didn't eat. But then the other people always feel bad. So I would say that it's always it's always easier just to not have things on the table. So if it's just you, have the server hold the bread, hold the chips, hold the starches, hold whatever it is that you don't want to be tempted by. When you go to parties, bring a dish that you can eat so that there's always something there for you. Eat before you go, and then maybe you're not even hungry. And use the mindset, instead of saying, I can't eat that, say, I choose not to eat that. Put yourself in the power seat, not in the defensive mode. Practice the 100% rule. I find it to be easier. Some people can live on the 99% rule, but to me, it's exhausting. And then it leads down to a slippery slope of, okay, I'll just have it a little, I'll have it a little, and then the next thing you know, you're having it a lot. The ultimate goal is really to change your metabolism so that the foods that you crave are actually the foods that will nourish you. So instead of thinking about what should I eat, think about, what foods will nourish me. How to handle cravings. If you're having cravings for carbs and sugars, it usually means that either your carb intake is not low enough or that you're still feeding that sweet addiction with diet, drinks, and sweeteners and things like that. Occasionally check your protein intake. If you're eating really lean protein and not enough fat, sometimes that will also stimulate that craving. If you're hungry all the time, then usually it's either A, you're not eating enough protein, you're not eating enough calories. So really, when you're eating this way, you should never feel like you're hungry all the time. In fact, you should almost feel the opposite of you're never really hungry. And sometimes I actually need to encourage patients to eat more because they're so not hungry that they don't actually eat enough calories. If you're craving chocolate, sometimes that's carbs, and so double check the carbs, but sometimes it's magnesium. So I find that in myself. So if I'm low on magnesium, I tend to crave chocolate. So if I'm craving chocolate, I just make sure, now have I been supplementing? Did I run out? So you can double check that in yourself. Craving chips or other salty foods. Maybe you need salt. So increase the salt on your foods. Maybe add some broths. Maybe add electrolyte supplements or even a pinch of salt to your water. Keto flu, I like to call it carb withdrawal. So there are some people when they first transition that get a headache, fatigue, dizziness, maybe lightheadedness or nausea, irritability. Drink plenty of fluids and add sodium, add magnesium. It should really just pass in a few days, although I will tell you the people who have the worst keto flu are probably the ones who need keto the most. So really trying to optimize that transition with electrolytes and fluids is a good idea. I always caution people that are on medications for diabetes or for blood pressure, you need to be very aware of how these medicines can affect blood sugar and blood pressure. We know that when we eat a ketogenic diet, we can actually reverse diabetes. So if people are on certain medications, it can actually be a problem. So we need to know that. I will say that metformin, which is the earliest diabetes medicine, is not a problem because of the mechanism of action. I will say that blood pressure usually comes down within a few weeks. Most people around 6 to 8 weeks actually need a reduction in blood pressure medicine, but diabetes medicines may actually be much, much quicker. And then our usual questions are always about, well, what about cholesterol? I shouldn't eat fatty meat. I shouldn't eat whole eggs because I have a cardiac risk in my family. And what about kidneys? Isn't protein bad for kidneys? Number one, we'll go through a few things, but I will say that when your kidneys are damaged, they definitely can leak protein. And so if you do have a kidney function problem, so kidney failure in any way, then you may need to do a lower protein form of this. But eating protein does not cause that kidney function dysfunction. It's actually caused by sugar and insulin. So if we look at cholesterol, we know that the higher the cholesterol, interestingly, that all-cause mortality actually goes down. And this is shown in males and in females when we look at the WHO data. So there's kind of a myth out there that high cholesterol will kill you. What we know is that when we look at different things and their impact on heart disease, that type 2 diabetes is absolutely the highest risk, 10 times the risk for heart disease with type 2 diabetes versus if we go down to LDL cholesterol in the blue. So they looked at risk factors in red and biochemical markers in blue. And LDL cholesterol was only 1.38 times the risk. And so I will say that many people who have high LDLs may also have high triglycerides or insulin resistance or diabetes or hypertension or obesity. So it may not be the LDL directly linked to that. And we can show you some other things, but it's really about diabetes and insulin resistance. This study, it looked at glucose after a glucose tolerance test. And the higher the blood glucose, the more likely you were to die of heart disease. So they did this 2-hour blood glucose test, but then they followed these people 33 years. So it may be that it was, things change throughout your life, right? You're not the same person you were 10 years ago or 15 years ago or 30 years ago. So it was just one snapshot in time. But if they already had evidence of insulin or glucose insulin dysregulation with over that 33-year period, they were much more likely to die of heart disease the higher their glucose was on that challenge. And Ted Naiman has shown, put into this nice graphic, that it's really about triglyceride and HDL. If you have high triglycerides and low HDL, you are at far more risk for hospitalization because of coronary artery disease and actually for any type of disease. And here's one that was just put out to predict COVID-19 severity. So symptom severity, it all came down to, so I will explain this chart. So the blue is for mild symptoms and orange is high symptoms. By the HDL, you can see a little asterisk at the bottom, and on the TG or triglycerides all the way to the right, there is an asterisk. What they found is that those two features were statistically significant, whereas LDL and total cholesterol were not significant. So if you had low total cholesterol or low LDL, there was no difference. If you had low HDL, there was a difference. You were more likely to have severe disease, although that was not dramatically different, but triglycerides was very dramatically different. So high triglycerides equals severe COVID-19 severity. Another research study that came out looking again at COVID-19 symptoms with high blood sugar. So what have I been saying for the last year and a half? Control your blood sugar and your insulin. But elevated blood glucose was the most likely single risk factor to explain why in otherwise healthy patients that they had severe disease with age and known comorbidities. So elevated blood glucose actually can facilitate every step of the SARS-CoV-2 infection. The elevated blood glucose increases the glucose in the pulmonary airway surface liquid, which breaks down the primary innate antiviral defenses in the lungs and facilitates the viral infection and replication. It causes dysregulations in the immune response that facilitates the cytokine storm and acute respiratory distress syndrome. Elevated glucose levels act synergistically with SARS-CoV-2 dependent inactivation of the ACE2 enzymes so that it escalates the disease into a multi-organ failure and thrombotic event. So it's about glucose and insulin. Pretty much every disease on the planet, every infection on the planet, this is what so instead of, fighting about masks and staying inside and social distancing, they should have been pounding this into everybody's head about lowering glucose and insulin. Eat real food, stop eating processed food, get outside, and exercise. So I showed this one, I think maybe last month, sorry. But the Virta Health comparing to an East Coast network of diabetics. So these are all type 2 diabetics, but those type 2 diabetics working with Virta Health on a very low carb ketogenic diet were 16 times less likely to die of COVID-19. And when we look at metabolic syndrome, when we look at a low carb versus a low fat diet, we can see that low carb diets lower glucose, insulin, and triglycerides far better than a low fat diet and raise HDL. And to touch on kidney function, this was a new study that was just out looking at low carb and ketogenic diets. This was done in breast cancer patients. They were looking at quality of life, physical performance, body composition, but also metabolic health. What they found was that there was a positive effect of a low carbohydrate diet on nearly all parameters that could be observed, including significant improvement in lipid profile and optimization of their liver profile and kidney function parameters. So a low carb, high fat diet did not worsen kidney function, but appeared to improve it. In addition, they had positive effects on their body composition and physical performance, and they reduced body weight and improved metabolic health and inflammatory situations. So all good, and back to why I advocate for it for everybody. And I thought I would share, so hopefully Angela got the packet up, because this was a great, I've always looked for a really good roll that you could serve like at Thanksgiving or something like that. And this is my new favorite roll, which is egg yolks, butter, and baking powder. Very simple and very delicious. So that's it. And I wanted to mention that next month I need to make a date change. September, the third Wednesday came up really fast. It was so I'm moving it to the fourth Wednesday, September 22. I will be out of town the third Wednesday, so I apologize for that, and we will send the links so that you will stay informed.